It's yet another beautiful day. Yeah, we are really glad that your eyes on Family TV. This is Health Pot. Edwin Austin Mukalas is my name. And remember, this program is brought to you by Makerere University School of Public Health, basically looking at early childhood development and maternal health. And today we moved out to KCCA, where we've met Dr. Otim Julius Simon. He's the manager epidemiology and disease control at KCCA. And Doctor, we are delighted to have you today. Kindly greet our esteemed viewers and then...
Good morning, viewers. I would want to thank all the viewers for tuning into this program, and I would also want to thank the School of Public Health for making this possible, giving us an opportunity to talk to our people and educate them about health.
Wow. So, Doctor, the reason we've come looking for you is there's a misconception about vaccination. And I think we start from there. What do you have to say about vaccination, COVID-19 vaccination?
Yeah, what I can say is that it is true that people have misconceptions. But most of these misconceptions, because people do listen to non-official sources, people go and pick wrong information from the social media.
Whatever comes through
they trust social media more than the information which the technical staff provide them. So there is really, I would want to say that people should not focus on misconceptions. They should focus on what the trained people are talking about. Let's focus on the science, because the science is based on evidence. Let's not pick rumors. For us in medicine, everything is done based on evidence. If you don't have evidence for anything, you cannot talk about it. So generally, I would want to tell people that they should go and vaccinate. More especially people, the ones we call priority groups. What do we mean by priority groups? Yeah. Priority groups are persons who are at the greatest risk of getting the severe disease if they get infected with corona, and they even at the greatest risk of dying. And in the first wave, we clearly saw these priority groups. For example, people who are older, more than 50 years and above. Yes. People who have chronic illnesses like diabetes, hypertension, living with HIV/AIDS, then people sickle cell and so on. Then of course the other priority groups are priority group because of the nature of the work they do. For example, the health workers, the security forces and so on. So that is the group we are focusing on. The teachers inclusive, because we want to open the schools. Yes. So I would want to tell people that please, let's go and get vaccinated whenever there is an opportunity. Because once we get vaccinated, we are going to start leading a normal life. Our children will go back to school, and then we shall not be able to have these lockdowns, because this thing has been very, very disruptive for all of us. And I can give a clear example. People are saying that vaccines are bad. Yes. But if you tune on TV, you find stadiums are full in Europe. Why? Because of vaccination. If those people were not vaccinated, you remember even Europe was under lockdown. They vaccinated their people, and now they are free their children at school. For us who are hesitating, for how long are we going to hesitate and keep children at home and wait for another wave? If we don't get vaccinated, if we don't stick to the standard operating procedures, we may have Christmas under lockdown, and that will be very, very unfortunate. So I would want people to go and get vaccinated. And if you have any questions related to vaccination, you go and ask the health workers. Even at the site of vaccination, all those health workers you meet there are actually trained. They can answer all your questions and all your concerns. I know that people have a right to ask. When you go for any treatment, we encourage you to ask questions. So if you come for vaccination and you ask that, which vaccine should I take? What should I expect as side effects? If I get side effects, whom can I call? What medicine can I take? All those things we answer them. So no need to go and pick gossip from social media. And then we frustrate a very good public health intervention which can save us.
So Doctor, of course we know that this vaccine, like any other vaccine, has some effects or that show up immediately, or maybe may show up after a day or what. What are some of these that someone can expect, and then when maybe they see them, they're not shocked?
In fact, what I can say that, for example, we organized a vaccination exercise for the Bankers Association, and I received, out of hundreds of people who vaccinated, I got 2 calls. And the people who called me asked me that, doctor, I took the vaccine, and I'm feeling body pain. What can I take? And I told them take Panadol. They have never called me again. That means that they are okay. Yeah. So most people just get because you take the vaccine so that your body can build immunity. Now when your body responds to that immunity, I mean to the vaccine, you can develop body pain, you can develop pain at the site of injection. And my cousin took the vaccine. He told me that he experienced a lot of coldness in the night. He was shivering the whole night when he was under blanket. But eventually, he was okay. And today he's calling me coming for a second dose. So those side effects are there. And also what I want to tell people is that once you are vaccinated, we stick all the numbers which you can call, which you can send a WhatsApp on your card, so that in case you have any worry, those numbers are toll free. You can even send a WhatsApp and shall be able to respond immediately, and that is managed by National Drug Authority. So we're able to track that. And then I also want to tell people that we have been vaccinating our children. Vaccines remain vaccines. So what is so special about corona that it makes people fear the vaccines a lot? When we have been vaccinating children, I could, as a parent, I can give an example. There is that vaccine which we give on the thigh of the child. Normally, when you go for that vaccine, you should be prepared for the night. The child will cry the whole night, yes. And the medical workers will tell you that if you have an ice, you go and rub it with the ice. So those are some of the things we'd expect. But we cannot risk death just because you fear to have a bit of pain in your body after the vaccination. I don't think that makes logic.
Pain for a few hours.
Pain for a few hours, fatigue, and then it too, for example, the fight, I think what would worry, very, very few people can develop what we call severe allergic reaction, maybe anaphylaxis. But what we do if you come for vaccination, after vaccination, we sit with you, tell you that sit with us for 30 minutes. After 30 minutes, if you have no issue, you are free, and then you go home, get your second vaccine. And once we vaccinate, the president has made it very clear that across the country, the moment we reach the 4.2 million people we are targeting, then we shall have the liberty and the children will go back to school. How long are we going to keep our children at home? Well, then we live under uncertainty of, having another lockdown. Sure. So we should go for vaccination and liberate ourselves.
So it is us, the keys in our hands.
It's about us taking responsibility. You need to vaccinate so that you protect yourself, you protect your dear ones, you protect your family, you protect your community, and you also protect your country. No, we cannot be safe until all of us are safe. I cannot say that I'm safe because I'm vaccinated unless all of us get the vaccine. And remember, because I may not fall sick because I'm vaccinated, but my children at home, they are not going to school, so I'm affected. If the lockdown happens, it will be very disruptive even for me.
That's true.
Yes.
So, Doctor, here at HealthPort, we have another priority group that is at risk, and I think most of these mothers fear to vaccinate. We have two groups, that is the pregnant mothers and the breastfeeding mothers, because they tell us that if you're sick, then they cannot vaccinate you. If you have maybe malaria or any illness, they cannot vaccinate you until you're fine. So I look at a pregnant mother. Can she vaccinate?
Pregnant mothers and breastfeeding mothers should go for vaccination. There is no evidence to show that there is any negative effect of the vaccine on pregnant mothers and breastfeeding mothers. I remember during the second wave, somebody sent me a picture on WhatsApp, and it showed a young lady, most likely she must have been 35 years of age, and she was seated, she had a young child, probably 8 months, who was breastfeeding. Then there was another child smiling beside her, and then there were 2 other young children. I think our children were between the age of, that were 8 months to 6 years. 4 children like this, a very beautiful young lady with very beautiful smiling children. And in that message, they say this mother has died and left his children. I was so touched. Because the death of the mother is beyond the death of the mother. Yeah. The death of the mother can actually imply the death of the family. That's what it means. Because normally, for children, once you lose your mother and you're young, it will be very difficult even for you to survive. Because even when you are sick, it's your mother to carry you to the hospital. Sure. It's your mother to nurse you when you are sick. So most children, when they lose their mother, their children also die. And the family is very disrupted. Actually, you can find that the death of the mother shatters the whole family. So it pains us. When a mother dies, it means a lot to the family. So mothers should go and get vaccinated because we need the mothers to bring up the children. Without our mothers, we would not be existing. So that's the message I would want to tell to our dear mothers. Please go and get vaccinated. We need you. You are so important to our families. You are too important to our children, and we need you so that our families are safe.
So, let us shortly go for a commercial break, and then when we come back, we are going to continue with our day's topic.
COVID is a pandemic, and is a terrible disease. This thing kills in days. You should take everything it takes to prevent and avoid getting it. Like like washing hands. What do you have to pay to wash hands? Putting on a mask, distancing. And if you are not attending a function, you are not attending a burial, will not stop that person from being buried, then don't go. And it's good we are in a digital era. Let's send money, no more borrow money as condolences to the people concerned and say, we are sorry, we cannot come, the situation. As simple as that. Our culture requires us to socialize, be near somebody and console them. Yes, correct. But the situation prevailing at the moment doesn't allow. These are simple matters. But we take it simply. You have to wait for the police to remind you, people to run after you. But life is yours.
Protect yourself from COVID-19 by washing your hands with soap, wearing your mask, keeping your distance, getting vaccinated, avoiding crowds, staying at home, and avoiding shaking hands and hugging.
Welcome back from the commercial break. This is Health Pot, brought to you by Makerere University School of Public Health, together with Family TV. And we are with Dr. Otim, taking us through vaccination. And before the commercial break, Doctor was telling us about why mothers need to go and vaccinate. And not only pregnant mothers, but even not only breastfeeding mothers as well, but even mothers. Every mother has to vaccinate because the survival of your child is in your hands. So, Doctor, I think before we close up with the issue of mothers and vaccination, what is your last message to the mothers out there?
My last message to the mothers out there is that they should go and get vaccinated. And we have received a number of vaccines, because for the vaccination exercise, we have different vaccines. So we received a vaccine called Sinovac, and we used to vaccinate teachers. We vaccinated about 13,000 teachers. So I'm sure the mothers who are teachers must have benefited from that exercise.
Yeah, Doctor, can't this vaccine cause any effect to a breastfeeding mother or a pregnant mother?
No, because like I told you that, for us in medicine, normally, everything you do, there should be evidence. We don't just imagine things. So far, the research which has been done, there is no evidence to see that the vaccine specifically negatively affects breastfeeding mothers or pregnant mothers. So we don't have that evidence. So that
Meaning
is why,
if a mother ever has issues of challenges with breastfeeding, or maybe if they're pregnant and then they have maybe a misconception, then that is another cause, another vaccine.
That is another cause. At least there is no evidence so far. And then also I would want to tell people that even when you go for the vaccination, usually there is what we call consent, and a lot of information is further provided to in that process of consent before you are given the vaccine. So now for those people, because we first received the AstraZeneca vaccine,
yes,
and that's what we started using to vaccinate people. So for those people who are eligible for second dose for AstraZeneca, they can come to all our facilities and the outreach sites, and they can get their second dose. Yes. Then for those people who want to start the vaccination, they can go and receive the Pfizer vaccine. We have it in plenty. So especially if you are there and you have an old person, you have somebody who's living possibly with HIV, because if we get another wave, those people are very, very, very high risk of what? Of dying. So the mother should go and get vaccinated. And I must say that, when we talk about family health is not about one thing, it's about the whole package. I would also want to add that we encourage mothers to go and get vaccinated to protect themselves against corona. But they also need to go and attend antenatal if you are pregnant, so that you can also get tetanus vaccine to protect your newborn baby against tetanus. And when you go for antenatal, you'll find that you'll be screened Even again, things which can cause you to miscarry. For example, syphilis. They can test for syphilis, UTI. If you have syphilis, if you have UTI, those are things which can cause you to miscarry. So they do screening and identify problems, and they treat those problems. If you're a mother, if you go and attend antenatal, maybe in L Center 3, they might identify a condition which you cannot know. For example, you could be having a high pressure when you're pregnant, what we call preeclampsia.
Yeah.
And that pressure doesn't pay. But when they check, they will tell you, mommy, for you now, I advise you to go to the other facility where there is a senior doctor. That's where you deliver from. You do not deliver from here. So there are so many important things you can get by attending to the facilities. Then, of course, in addition, we would want mothers to practice what we call family care practices. These are a whole package of things you need to do at home. Of course, one of the key things is to make sure that you breastfeed your child. We normally encourage mothers to breastfeed for at least exclusively, meaning only breast milk, exclusively for 6 months if you can. Of course, I know some mothers may be constrained because of work and so on, but if you can,
And some others are just lazy at
exactly.
breastfeeding.
So you need to breastfeed your child for at least 6 months. There is evidence that children who are breastfed, even the brain develops better, they end up being very bright at school. And that breast milk contains antibodies. Most children who are breastfed do not even fall sick in the first 6 months. You find that most of them do not even fall sick, and they grow very fast. So breastfeeding is very key. Then after your child has reached 6 months, you can now start giving supplementary feeds, because now the child is getting bigger and the breast milk may not be enough. So you start giving the child supplementary feeds, which those supplementary feeds should be given under extremely clean and hygienic conditions. Because if you give a child supplementary feeds when you are dirty, then the child will get diarrhea and die. So you start giving your child supplementary feeds. And then, God was very wise. Normally, mothers who breastfeed frequently all the time, they do not even conceive. Most of them don't even conceive. It's like God knew that let this child first grow before the mother gets what? Pregnant again. And so you find that breastfeeding also has an advantage because it promotes child spacing. Child spacing promotes child survival.
Exactly.
Because you find, for example, if a mother he has a baby who's just maybe 5 months and she gets pregnant and delivers another baby, you find that mother is constrained. And you'll find that those children may not be able to lead a very healthy life. So God knew that children should grow and then before somebody gets another child. So child spacing in the wisdom of God is very important. And automatically God provided that once a mother is breastfeeding all the time, she may not be able to conceive. So that's another advantage of breastfeeding. Then of course there are also things which are extremely important in addition to breastfeeding. Also a balanced diet generally for the whole family. And many times people imagine that for you to feed well, you must be a very rich person.
Yeah.
It's not the case. It's about managing your resources. I can just give a simple example. The little you have, you find somebody goes and buys maybe something more expensive, a fruit or from a supermarket or a soda. But for example, if you have a setup at home and you just buy millet, just a kilo of millet, and you grind it well, then you just, if you are staying, for example, in the village where there are milk cows, you just buy 1 cup of milk. Then you make millet porridge, and then you just add a cup in the morning, add some milk onto that millet porridge, and you give to your child. You'll find that even if the nutrition, what you feed is not so good at home, you'll find that that child will never get malnourished because of just milk, just millet porridge and milk added onto it. So when you look around our environment, there are so many healthy things we can afford. Doesn't mean that for you to feed well, then you should be able to buy kilos of pork and so on, kilos of meat and so on. Yes, if you can afford well and good, you can buy that for your children. But within our environment, there are so many healthy foods.
God created
and good feeding
and the means of everyone.
Exactly. And the good thing is that good nutrition is not eating too much of one thing. Good nutrition means you eat everything. When you are able to have your pawpaw, eat your pawpaw. Cut your pineapple, eat your avocado, eat your greens. If you're able to eat some meat, eat it. If you're able to make your millet porridge and add milk in it, eat it. So in our environment, there are lots of foods within the environment. Because sometimes people say, for me, I don't have money, so I cannot feed my children well. But if you plan well within your environment, you can be able to provide good nutrition for your children. And now you can find because many people are now involved in this farming chicken, and so even eggs are not very expensive. So if you can afford to buy, how much is an egg? Is it 300 shillings?
These days it is between 300 and 400.
Yes. So if you can, for example, if you have a young
3
child,
eggs, 1,000.
yes, if you can have if you can invest 3 eggs in a week, your child can never get malnourished.
That is 1,000 shillings.
Yes. So for example, I was talking about millet porridge. If I make my millet porridge in a cup, then I put an egg yolk and I mix and I give the baby. Good enough. Even if I have boiled cassava, that child will eat cassava, but the other milk and the egg is going to protect the child from malnutrition, and the child can grow normally. So once you plan, you should be able to protect the family. Then the other thing which are important, general hygiene, making sure that we dispose some of these things like poop of a child. We dispose it well, we wash hands, we make sure that the environment is clean, we sleep under mosquito net. Mosquito nets are given freely because malaria can also be a very big problem.
Yeah.
We make sure that children get early treatment. When a child is sick, go and they check. Don't wait. Then you go, they tell you, oh, your child is already too anemic, there is no blood. Then you call now, go to hospital, they tell you we don't have blood because the children are in holidays, they don't donate. Then the child dies unnecessarily. The other thing which I want to warn mothers about is the environment where our children live. We need to be very, very careful about the environment where our children live. If you go to Chirudu Hospital, the burns unit, you can shed tears. You find children have been burned and the hands have been cut off. All the fingers have been cut off. And when you look at the story, you find that there was carelessness. There is a child who's crawling, but the mother was cooking in a sigiri in a place which was not enclosed. So the child went and overturned the saucepan of water and got burned.
Or maybe some sell chips at the roadside and
they
then
sell
they go with this child, and then as the child is crawling, they pull the whatever the frying
You
pan.
find situations where people keep petrol in a house because the husband is border. Then they direct young children to cook. Then you find there was an explosion and the house burnt and everybody got burnt in the house. So let's be mindful about the environment where we keep our children, because injuries have become a very big problem. And you find these injuries can be so debilitating. Imagine your young child gets burnt and the hands are being cut off. Now child cannot write. Some of them even the leg gets cut off. So let's be mindful about the environment where we keep our children so that the children can grow. So those are the things which are very, very important for us. So we need to look at the whole context of growth for the child. Of course, there are also other important things. Also be mindful, these days people go and steal children and murder them and so on. So you need to keep an eye. When you leave children at home, there should be an adult who's responsible, or a neighbor who can look after your child. We don't want situations where you find those nasty stories about how somebody went and stole somebody's child. So focusing on those family care practices, which the VHTs even know. We expect them to be moving from household to household to educate their mothers. If you're pregnant, attending antenatal early. Those are some of the things.
I think the challenge is the VHTs do their work, but mothers tend to, undermine them. They look at them as people who are not professional in what they're doing.
I would say that, actually what is very important for health is for you to build health at the level of the household. By the time you go to hospital, it means so many things have gone wrong in your household. So VHTs are very important. And if they do their work and you listen to them, you'll find that you'll rarely visit the hospital. Those things have recounted. Having, disposing people well, washing hands, good nutrition, safeguarding children and so on. Those things will keep us safe. Those are the things you need at the household. When you go now to the hospital, it means things have gone wrong. You don't have a mosquito net, you have drunk that out, now you are sick. And we do not encourage that. We focus on promoting health and preventing disease. That is the focus. And normally it's much more cost effective for you to prevent than to treat. Just washing hands to prevent diarrhea. I mean, how much does water cost? Or a piece of soap? If you buy one piece of soap, if you're alone, you might even use it for 2 weeks.
Yes.
But if you fall sick from dysentery and you go to a private facility, you'll get a bill there you'll not believe. They'll tell you 500,000. So you can imagine. So if we don't manage health well,
box soap at 500.
Exactly. So if we don't manage health well, ill health is going to cause a lot of poverty in our homes. We have had stories where people go, they are admitted because of corona, they are admitted in intensive care. Then the bill comes 150 million. Then they tell you the person has even died, but you pay 150 million to take the body.
You the body.
Now just imagine if that person wanted to get vaccinated and wouldn't have died. First of all, the death alone is a very big issue to the family. A big loss. Then the bill of 150 million to take away the body, it means you have to sell the home. That means the children left, the orphans left behind will have no home. They will have no father to look after. So you can see the implications of the things we don't do when we have even heard about it. It can have a devastating effect in our families. So that's why it's very important that mothers stick to those basic family care practices, which are really, really important, so that we bring up our children well.
So, thank you so much, Doctor, for that message. But then, before we still leave, there is this common question about the vaccines. Now that you've mentioned about the vaccines, if I had my first dose of Sinovac, is it Sinovac?
Yes, Sinovac, Pfizer, whatever.
Yes, and then it is no longer in stock, then time has reached, I have to go for my second dose, my second jab. Can I be immunized with maybe AstraZeneca or Pfizer or any?
No, that's a good question. What I can say is that when you have gotten vaccinated with, for example, AstraZeneca, again, you need to stick to the same vaccine. You don't mix vaccines because already we are worried about side effects. We need to monitor. So if you mix so many things, we cannot now, if you get a vaccine and you get severe headache, now we wonder, is it the first or the second one? So I want to advise people that you stick to the first vaccine. I know sometimes if you get, maybe you're injected with the Pfizer vaccine, then they tell you that you'll get your second dose after 4 weeks. Then you come, they tell you it's not out of stock. That one should not worry, because eventually we shall get it, just a slight delay. Because if there is a slight delay, you remember when we first got Pfizer, they were saying you get a second dose after 8 weeks. But there was even evidence that if you get it a bit later, the response was better. Then we adjusted that to now to report come for the vaccine after what? After 12 weeks. So if you're due to get your vaccine, like most teachers actually,
Yes.
the ones who got Sinovac, they are due to get the vaccine now, but we don't have the vaccine. As long as we are not going to spend 6 months without the vaccine, there is no harm. If they got the vaccine 1 month after the expected date, it is still okay. There is no problem with that. Of course, like the president said, that there is even nowhere where they sell vaccines. So we mainly depend on donations. So sometimes we have those gaps. But don't blame, it's not because of the health workers, not because of anyone. It is just that the world is competing for vaccines and there's nothing we can do about it.
And
but whenever we get, we announce.
understand
People just need to understand, yes. Because there are many good things we want to do. But sometimes these limitations are there in our country and there's nothing we can do about it. There's nobody you can blame about it. Yeah.
Doctor, your last call for vaccination as we wind up.
So I would want to tell people that we received vaccines, about 250,000. We have only dispensed about a quarter of those vaccines. And the response is very poor still. I don't know why. I was told that, I remember sometime during the second wave, people were running to Kololo, and somebody said that if you went to get vaccinated in Kololo, there was even a higher risk of getting corona than getting the vaccine itself because of the crowds which are there. Now it's very unfortunate that we have the vaccine and people are waiting. So people want to wait. Then when we get another wave, remember every wave comes with death. After then they start running around looking for vaccines everywhere. Let's be proactive. Let's not wait until something happens. Let's do things early so that we can be able to protect ourselves. Remember, the president has said a condition that unless you vaccinate the target population, the schools will not open. So if we sit back, are we going to remain like this? So people should go and get vaccinated. It's very, very important, especially the priority groups, because if we get another wave, those people will get severe disease and some of them will die, and that will be very, very unfortunate.
Wow. Thank you so much. We are with Dr. Otim. He's the manager, epidemiology and disease control at KCCA. And thank you so much for watching Family TV. Thank you so much for watching HealthPort. Maybe before I leave, I need to remind you that we are going to change in the timing of this show, and I believe it is for the better of you, our viewers. So it will now run on Wednesday at exactly 10:30 a.m. Thank you so much. Edwin Austin Mkalas is my name, and I've worked with Jonah Jao, the producer, Bantam in transmission, Tony Santo on social media, and Brenda Tijakira. Have a good night. God bless you.